Good afternoon, everyone, and welcome to this press briefing today on Monday, the 23rd of March. I'd like to welcome you, the viewing public, and of course the listening public and the media, to our discussion here today with our esteemed panelists of government leaders, beginning with His Excellency Governor Martin Roper, Premier the Honourable Alden McLaughlin, Dr. John Lee, Chief Medical Officer, the Honourable Dwayne Seymour, Minister of Health, and Police Commissioner Mr. Derek Byrne. Thank you to all of you for being here with us. Lots of questions. The weekend is now over. Dr. Lee, can we start with you?
Thank you. Good afternoon. I need to announce today that there are 2 further positive cases from Health City Cayman Islands. In addition, we have some other results which are imminently going to be shared but are not yet available for sharing. I'd also like to mention there's about a case of a gentleman who was resident in the Cayman Islands who's now died in Honduras. We were made of this, at the moment that Public Health was made aware of this case, we began contact tracing his close contacts in Cayman. We've yet to receive any official confirmation that his death was related to COVID-19.
Okay. Your Excellency?
Okay, thank you very much, Donna. Good afternoon, everybody. In the last few days, we have welcomed home Caymanians and Cayman residents from countries overseas that have recorded significant numbers of COVID-19 cases. As a result, strict measures have already been introduced to keep the public safe and help to prevent a rapid spread of COVID-19. And as I've said repeatedly, I fully support the robust and timely action taken by government. And let me also just underline the Chief Medical Officer's requirement, mandated by law, for returning travellers who arrived in Cayman after the 16th of March 2020 to isolate for 14 days. And travellers who arrived before this date should also self-isolate for a similar period to help reduce risks to the public. In order to help enforce these measures, I am today announcing the imposition of a curfew throughout all 3 islands. The curfew will begin tomorrow, 24 March 2020, and will be in force from 9 p.m. in the evening until 5 a.m. in the morning. Persons are required to remain in their homes and premises during these hours unless the Police Commissioner has exempted them from doing so in writing, and the Commissioner will be issuing a list of exempted persons shortly. The curfew is being imposed under Section 49 of the Police Law 2017 revision and has been authorised after consultation with the National Hazard Management Executive, which includes the Premier and the Leader of the Opposition, and Cabinet has also just given its agreement to this. The curfew will initially be in force for 10 days and will be reassessed by the Police Commissioner every 48 hours. The Commissioner will also provide further guidance as necessary. Anyone who fails to comply with the curfew will be subject to arrest by the police without a warrant, and on summary conviction will be liable to a fine of $3,000 or to imprisonment for 1 year or to both. Now, at this time, there is no need for a state of emergency to be declared, but this will be kept under review in close consultation with the Premier and the Cabinet. It is right that the elected government, which has an extensive degree of domestic autonomy, leads our response, fully supported by the UK through me as Governor. And I believe our Premier is doing an excellent job in highly challenging circumstances. Indeed, my relationship with the Premier, Ministers and opposition leaders is built on a solid foundation of trust and partnership, and that is exactly what is needed at this difficult time. We are living in extraordinary times, and the global situation remains serious and dynamic. The government and I are determined to do all we can to ensure that Cayman takes early and decisive action to help minimise the risks to everyone, and in particular our elderly and vulnerable people. and it is vital that everyone plays their part. Every action by each one of us could directly affect the life and health of someone in our community. All of us have a responsibility to act in a way that will help prevent the spread of the virus. So again, please do follow advice on hygiene measures, social distancing, and even outside curfew hours, please avoid unnecessary contact with others. Stay at home as much as possible, and if you see people acting irresponsibly, please notify the police. I'm also aware of difficulties likely to be faced by many people due to the closure of the airport and the suspension of flights. This measure was fully necessary, but we will be seeking to keep emergency connections open, and we are looking with British Airways at the possibility of maintaining an air bridge to the UK and the overseas territories. Any flights that are arranged will be exceptional and will only allow outbound passengers. I'm therefore pleased to announce that we are establishing an emergency travel helpline which will enable us to give advice and assistance where possible to those who have an urgent and compassionate need to travel whilst this situation continues. The emergency travel helpline will operate from 9 a.m. to 5 p.m. Monday to Friday. And I should stress again that this is only for emergencies, so please only contact the helpline if your issue is compassionate in nature. We will try to help, but travel options across the region are very limited, and we may not be able to assist everyone. The helpline is due to open tomorrow morning, and the telephone number will be advertised on social media pages and government websites, Premier's social media pages, and all Cayman Islands government websites as well. Finally, I would like to thank everyone who is working tirelessly to keep us safe and minimise disruption to these islands during this very difficult period. We will come through this, and I will not waver in my commitment to support government in taking any further measures needed to save lives. Thank you.
Thank you, Your Excellency. Premier McLaughlin.
Thank you. Hello, everyone. I believe everyone in the world that has access to any kind of media is following what's transpiring across the world with respect to the continued spread of COVID-19 and the consequences of that. There are now more than 332,000 cases. We're approaching 14,000 deaths. In the United States alone, we're at about 32,000 cases. This is, without question, the gravest health situation that the world has faced in at least 100 years. Here, as the governor has just announced, we are doing everything we can to suppress the transmission of COVID-19 through the broader community. The curfew measures which the governor just announced are aimed precisely at that. We are doing everything we can to get as many people off the road, to distance people from one another in an effort to slow the transmission of the disease through the community. In addition to the curfew measures, I am today announcing that Cabinet has decided, along with the National Hazard Management Executive, has decided to reduce the number of persons who are able to congregate from 50 to 10. This, obviously, and for clarity, because we get so many questions, does not apply to the workplace. We are not yet at the stage where we are shutting down Cayman completely. And we fully understand that for workplaces, many workplaces to operate, they will need to have more than 10 people at work. But we are encouraging all businesses to send home or let stay at home all but absolutely essential personnel. And for businesses who do continue to operate, and we're not asking you, we are insisting that you put in place measures to ensure adequate social distancing, which we believe should be 6 feet at a minimum. You need to put in place provisions within your workplace that do not allow employees to come within 6 feet of each other. The previous regulations that we put in place exempted supermarkets and pharmacies from this restriction. This continues to pose serious issues for us. For all of the good measures and good work that's going on to protect Cayman could be completely undermined if people are crushed together in the supermarkets or in the pharmacies. We have also had issues raised about the Home Depots where significant numbers of people have collected together. So the new regulations, which will come into force tomorrow, will require all supermarkets and pharmacies and the named stores, which are the big stores, the really big stores, to have in place provisions which keep staff and customers a minimum of 6 feet apart. For the abundance of clarity, mini-marts, gas stations, convenience stores, and the likes are not supermarkets and are subject to the 10-person maximum customers within the given space. But they are also subject to the 6-foot distancing requirement. So if your convenience store or gas station or mini-mart is too small to accommodate 10 customers keeping the 6-foot distance, then you need to reduce that number to ensure that you comply with the distancing requirement. Further, effective tomorrow, at the time that the curfew comes into effect, all public transport will be suspended for 2 weeks, and the bus depot next to the Georgetown Library closed. We are still working on measures to allow the safe movement of people who absolutely have to go to work to be able to do so. Public transport for this purpose does not include taxi operators. Taxi operators may continue to operate, but limiting passengers to 2, and with every effort being made to create as much space between them as possible. So last night we closed. No, I have one more issue before I go on to the broader discussion. Public beaches. In this time of quarantine and self-isolation, we know, and all of the advice, medical advice and guidance tells us people need to have access to fresh air, opportunities to exercise, and so forth. The public beaches provide a wonderful opportunity, something that many places in the world just don't have, where people can get out and get some fresh air, some exercise, have a swim without congregating in great numbers. But over the course of this past weekend, there has been incredibly irresponsible behavior by many people, not just along 7 Mile Beach, but also up at Rum Point. People treating this as though this is some sort of spring break. Adult people, people that otherwise you would regard as incredibly irresponsible. This is the last warning. We are putting in place regulations which restrict the numbers of people who can congregate in any public place to 10. That applies to beaches as well. The police will arrest people who are breaking the law. But I go further. If we have more instances of this, we will be forced to shut down the public beaches. That would be a terrible consequence in terms of the options that remain available for people to live life with some reasonable sense of normalcy. But it is something we will be forced to do if the public continues to flout this provision and to ignore the grave consequences of too many people congregating together in these times. So let me just finish with some observations. This is all incredibly stressful for everyone. Many people are panicking. Many people are having mental health issues because of the stress. These provisions that we have announced today increase the restrictions that are already on normal life. Believe you me, we understand that very well. Not only are some of them inconvenient, many of them are having and will continue to have serious economic impact on people's lives. The government is considering all of those things and working madly behind the scenes, coming up with measures to make life as normal as we possibly can for everyone. But I need everyone to believe that this is a massive national effort to save our own lives and those of the people that we love most. It needs everybody, I mean everybody, to believe in this the way you believe that Christ died for sinners. I am serious. Unless it becomes that kind of a mindset for this nation, we are going to face the consequences that we see every day on the television. We are not exempt from this virus. I want everybody to just consider this. Watch the television if you never do. Just go to BBC, go to Al Jazeera, go NBC, CNB, go anywhere. You can't watch it for 2 minutes that this is not the issue. We have put in place some measures earlier than most countries in the world did, which, pray God, they work. We appear to be ahead of the curve with respect to the virus. Countries, many countries, and Italy is probably the best or worst example, depending on how you view it, of that, where the virus got way ahead of government's actions and the country's ability, particularly its health services ability to deal with the consequences. Hopefully we are still ahead of the curve. We have now shut down the borders of this country. Who's here is here. What's here is here. If our measures succeed, we will go through 2 weeks of great inconvenience and stress. But if our measures succeed, we will have prevented community spread. And then we can look at how we can relax some of these strictures and let people live a more normal life. But if we fail, it is not going to be 2 weeks of semi-lockdown. It is going to be a minimum of 12 weeks of absolute lockdown. Hundreds of deaths, many funerals that we are not going to be able to attend because of the restrictions on numbers. That is what we all need to appreciate. That is why we cannot behave flippantly about this matter. It needs every single soul who is here to believe that this is the right thing and that we absolutely must do it. I thank all the many people who are working so hard to make this happen, to keep us from keep disaster from attending us. They have many more days and weeks ahead. And I want everyone to believe and to support all of the emergency personnel, the doctors, the nurses, all the healthcare staff, all of the people who are working to keep this country safe. They need your thoughts, your prayers, and your reasonableness in expectations. Everybody is working super hard. Everybody is doing the best. The police, in particular, are going to be under great stress in the next couple of weeks, 10 days, as they seek to enforce this curfew. Please give them your cooperation and your support. I am sorry to be so morbid, so appear so worried about this, but folk, this is the harsh reality this country faces. We are in a much better place than anywhere else I know around when it comes to these things. Let's do this. Let's set an example for the world about how you manage an epidemic like this. But we need each and every one of you. I appeal to you as your premier, each and every one of you. Let's view this with the seriousness which it deserves, which it warrants, and let's save Cayman and each other together.
Thank you, Premier McLaughlin. Minister for Health, the Honourable Dwayne Seymour.
Thank you, Donna. Good evening, everyone, including Cayman Brac and Little Cayman. I want to say a big thank you to everyone who has been following the restrictive but very important measures put in place. We know it is not easy to immediately prohibit yourselves to habits never practiced before, but prevention is better than cure. The government aims to reduce the possible spread so we don't overburden the resources that are in demand worldwide and causing shortages. We are in this together, even whilst we are making these difficult decisions. Let it be clear, or let me explain. Viruses are tiny organisms that live inside hosts like you. When you have a viral infection like influenza or novel coronavirus, it means that the virus is living inside you, inside your body. Every time we have a new case, it means COVID-19 has spread from one person to another. Like any living organism, viruses multiply and spread to make sure they'll survive. So it spreads from person to person through droplets that an infected person sneezes or coughs out. These droplets can enter your body through the mucous membrane, the wet parts of your face, eye, nose, mouth, which provides a direct pathway to your throat and lungs. The good news is that it can't get in other parts of your body, like your skin or your hair. Please don't flirt with this disease, as it remains quite deceitful in an asymptomatic manner. Please take tissue or wipes with you whilst opening doors, or use other methods. Please use a pen or other items to press keypads, or whilst putting in PIN codes at banks. Washing your hand and keeping them clean and out of your face is some of the best ways to prevent this disease. We can't reiterate enough. Please don't display any prejudices against persons displaying COVID-19 symptoms. Please be reasonable and just keep your distance of 6 feet or 2 meters. I want to say how proud we are of all of the students and residents who isolated themselves so unselfishly. Your decision was so remarkable. Kudos to you. We encourage you to stay active, to keep your mental and physical state well. The success to saving the lives of our people depends on you, the whole of the community. We need you to do your part in safeguarding you, your life, your family, and your neighbor. Take all precautions, especially if you're at risk. We can stay ahead of this disease by saving more lives than we lose. I ask you at this time to be very frugal. This may last a while. Conserve and all. Don't spend it. Thank you. God bless.
Thank you, Minister for Health. Police Commissioner, do you have a few words you'd like to say before we...
Thank you, Donna.
Yeah.
Good afternoon, ladies and gentlemen. I think you've all heard the graphic detail from His Excellency, the Governor and the Premier about the heightened threat and risk level that exists in Cayman Islands as we sit here today, particularly with the return of high numbers over the past weekend. Dr. Lee and the Minister have been speaking to us since the start of this pandemic around the medical emergency or public health emergency that exists in the Cayman Islands, and it is a really, really challenging period. I would now like to just make reference to Section 49 of the Police Law 2017 revision. And it says, where it appears to the Commissioner that having regard to an immediate threat to any of the islands of a tropical hurricane or other serious hazard, and I do consider this pandemic to be a serious hazard, the effect on any of the islands or any tropical storm, hurricane or other serious hazard, that there are reasonable grounds to believe that in the interest of public safety or public order, it is necessary so to do, the Commissioner may, with the written permission of the Governor, and the Governor has consulted with the National Hazard Management Executive and the Cabinet, impose a curfew throughout the islands. Excuse me. So I have consulted with His Excellency the Governor of the Cayman Islands, and I anticipate that I will receive written permission later this evening to impose a curfew throughout the Cayman Islands between the hours of 9 p.m. and 5 a.m. nightly, commencing tomorrow evening, Tuesday, the 24th of March 2020, and continuing for a period of 10 nights, concluding at 5 a.m. on Friday morning, the 3rd of April 2020, as it stands. This order is made as it appears to me that having regard to the immediate threat of a serious hazard across the Cayman Islands associated with the COVID-19 pandemic, that there are reasonable grounds to believe that in the interest of public safety, it is necessary to do so.
Thank you, Commissioner. I'd just like to say to the public that if you have a question that is not answered here today, for whatever reason it can't be, that you can go online to gov.ky starting tomorrow morning and click on the FAQ section where your questions will be placed and answered for you. Also, if you're a civil servant and you have a question that is related to HR matters, we're asking that you email hrconnect@gov.ky with any of those questions for civil servants specifically. Now we're going to move on to the question and answer section. Do you have a question, Reshma?
Yes, thank you, Donna. Good afternoon, everyone. First of all, Governor Reshma Raghunath Cayman Compass. Can you explain to us why the decision was taken to implement a curfew and why these specific hours? What has changed to bring about this decision?
I think the Premier set it out very well in terms of why this next sort of 10-day, 2-week period is absolutely crucial for us. We've got ourselves into a good position, but with so many people coming back from areas where there were many cases of COVID-19, we just want to do absolutely everything possible to mitigate that risk. And a curfew will further reduce the numbers of people out and about. So it is a sensible precautionary measure. And as the Premier said, we'll have to see where we are in 10 days. And there will be a possibility, if we don't get island-wide spread of COVID-19, that we can look at possibly lifting those restrictions. But this is really the crucial period, this next 10 days for everybody on these islands. It really matters, as the Premier said, and we're trying to do everything we can to get ourselves in the best position without completely, at this stage, closing down the island. So it's a sensible measure, and I think it's what we need.
Why these specific times, though, 9 to 5?
Because that's we're not having a curfew. We're not closing the islands down. We're not locked. So there is still business going on during the day. But by having a curfew at night-time hours, we are reducing the possibility that people will want to go to each other's houses in large groups after 9 o'clock. That would be one possibility which we want to avoid. But this is simply a sensible measure to avoid people congregating in large groups and really make sure we can prevent that.
If I might add, thank you, Governor, for explaining that. So we looked at trying to keep some of the essential businesses and services that are available, to keep them going at least for the next little while. So we've got to give people a chance to get to work, to be able to go into the supermarket or the pharmacy and get what they need and get home. The supermarkets, all the stores will close at 8 so that people have an hour to get home. So that's the thinking behind that. And obviously, locking it down at 9 o'clock, we're trying to discourage as far as possible people moving about and interacting, going over to the friend's place and hanging out or partying or whatever the case may be. You need 9 o'clock, unless you are an essential worker who has an identification and you are on that list that the commissioner will issue shortly, you're supposed to be in your house. We had a lot of students return. I am very proud of the 137 of them who have volunteered to go into isolation in the properties provided so kindly by the private sector, the hotels, and being monitored by government. But I want to appeal to many other students and young people in particular. Please don't see this as an opportunity for a party. It is human nature, and young people more so than older people, to want to get together and socialize and have a drink. That's fine. But do it in your own home with your own family.
Just continuing on that, Donna, if you don't mind. Commissioner, can you provide us with, say, how are you going to manage this in terms of resources, and also any assurances that you can give to the public that there won't be any incidents of excessive force as you try to enforce this curfew?
So I think the first assurance I should give is that there will certainly be no use of excessive force as we seek to go about imposing the curfew. And I think, as the Governor had quite rightly said, and the Premier, we seek the full cooperation and assistance of the community, and I don't think we'll get anything less. The curfew is a necessary requirement at this time because of the situation we're in, which has already been explained. Normal policing will continue, and additional resources will be employed throughout the islands to enforce the curfew. And the Governor has set out in detail the offences that are committed and the fines that can be imposed for persons who decide to contravene the order. And I expect that they will be few and far between. We are looking for full cooperation and a partnership. There's too much at stake, and it's for the good of the island that it's being done, for good of our own communities. So I can assure certainly no excessive force. We'll be looking to have a reasonable and a practical application of the law with common sense and sound judgment. We do understand completely that there are essential services. People must travel to and from work, and we must maintain essential services, and we'll approach it on that basis.
I have a question from CNS is asking, do we have any idea what the population is now with all of the departures over the last week, plus the returning residents, to give public health an idea of the potential numbers they could be dealing with based on the numbers of expected infections and those who will get sick?
I don't have the numbers with me now following the weekend, but I think as of Friday, there were some almost 6,000 visitors who had left. The number of persons on permits, I don't know. But we will endeavor to get that number and let you know. But if you wanted me to, let me not do that.
Okay, hopefully
I'm not
that.
get quoted. I'm not going to do it.
Also, another question. This one might be for His Excellency. One person says that they understand there's been a hunger strike at Northwood Prison since last week after 3 detainees or inmates were brought in. And they have some concerns because apparently one of the persons was having a really bad cough. Can you explain if that is so? And if so, what's happening?
That isn't the case as far as I am aware. I mean, clearly, as everywhere in the world, there will be concerns around COVID-19 by prisoners and staff. And I've been working closely with the prison director and the ministry and looking at what measures can be put in place to help address those concerns. So a lot of work is being done behind the scenes, and just to say that we are very much aware that this is a major concern.
Okay, thank you.
Good afternoon, Kevin Morales, Cayman Compass. Mr. Roper, just a few minutes ago, you had said that you stopped short of declaring, I guess, a national emergency. Can you tell me what would it take for Cayman to get to that point, and what does that mean at that point?
Well, a state of emergency can be imposed, and I work on the concept of partnership and trust. So this will be a decision that I would take if I was advised by the Premier that this was something that was needed in the islands. But I think we're a long way from that point, and as I said, it's right that the elected government leads this response. But if we were to get a serious breakdown of law and order, maybe we needed assistance from the UK. Those are the sorts of situations when a state of emergency might be needed to pass regulations more quickly to face whatever situation we were facing. But we are a long way from that at the moment.
All right, thank you. Dr. Lee, you had talked about imminent results that we would talk about later on. Do you mind expanding on that? Is that just further test results that we're waiting on, or?
We have some results. We just simply haven't had the time to look through them in detail, Kevin. I know you might think, well, why not? Well, because we received them very, very shortly before the meeting. We need to alert the patients. We need to we have to match the lab results with the results from the hospital system to make sure the names are all matched up. And we just simply haven't had the time to sit down to do it.
And the 2 new cases you had mentioned are also Health City staffers.
Yes.
Also, I'm assuming, and correct me if I'm wrong, had been isolated this entire time. Same situation as the other 2 patients?
The 2 cases are from Health City. Again, I have not been able to check of the situation of those 2, but they're from Health City.
Okay, thank you very much. And if I can just get one more in. Mr. McLaughlin, following up on I think Wendy's question. So even if we don't have the population numbers, do we have a rough estimate of how many people left over the weekend, or I guess over the past week?
I would be guessing. The numbers I gave you are the ones that I actually saw those numbers. I would have to try to work out in my head how many went. I have a rough idea, but I really don't want to be quoted when the numbers are available. It'll just be tomorrow and I'll have them for you.
Right. And last one, and this is open to anybody. Every so often we'll receive comments, or you'll see the comments online saying all of these restrictions, all of these things that are going to hurt the economy and cost Cayman millions and millions of dollars, is it worth it? Especially for, a virus with a relatively low mortality rate. What would you say to people who have that opinion?
Well, statistics. Statistics like that, you got a what, 1% or 2% mortality rate. That sounds great, except if you were one of those statistics, or your mother, or your father, because I don't know why, but 70% of the people dying are older men. So our objective is to reduce as far as possible the number of people who contract this disease, and therefore the number of people who have the possibility of dying from it. Every life is important. Every life. We're not going on statistics here.
I mean, just if I could just add very briefly, I mean, it is our duty to protect the life of everybody on these islands, and that's absolutely fundamental. I mean, in the UK, over the weekend, it's emerged that some younger people who have no health problems are getting into serious difficulties, and we've had a death of a person in their 30s. So there's a lot about this virus we do not know, and younger people shouldn't assume that this won't affect them. We don't know that. So I think it's absolutely imperative that we do everything to protect the life of everybody on these islands, and that's what we're committed to doing.
I'd like to say that with all the measures, and I know the measures that we're putting in place affect some worse than others, and but I dare to say that the disruption for safety rather than being behind the eight ball like Italy or France or Spain, I would rather being ahead of the game with this disruption than where they're at in fear and confusion.
I have a question from the public. This relates to HSA staff, some of whom apparently have been given doctor's orders to stay home, but they're actually being called in to work. I don't know if this is the case, but obviously this person said that they know and they just want to find out why this is happening.
But can you repeat that, please?
There's some HSA staff who have been given doctor's orders to stay home, but they're being called in to work anyway. The person would like to know why that's happening.
We're lucky enough to have Dr. Williams here from the HSA. He may be able to address that
Okay,
point.
if you could give him the mic, please. Thank you. Dr. Williams, if you could stand for us.
Yeah, basically, you said yes. You said that there are some HSA staff say the question again.
That have been given doctor's orders to stay home. However, they're still being called in to work.
I don't have the details of any particular case, but if any staff from the HSA or anywhere have had doctors know to stay home, it is very unlikely that they were going to be requested to come back to work, especially from the HSA.
Yeah. Thank you, Dr. Williams. Another question relates to Premier McLaughlin. Does the current measures apply to all non-essential services, including construction sites, non-essential stores?
Will you repeat that again? Sorry, I was a bit distracted.
The current measures that are now in place, does it apply to non-essential services, including stores that are non-essential? I don't know, it could be a boutique or something, and construction sites as well.
Which measures? No.
The curfew, I think they're talking about the curfew.
The gatherings, presumably.
And the gatherings.
Right. The only carve-outs from the 10-person rule are work sites, generally.
Right.
With respect to workers, not visitors to the site.
Okay.
Pharmacies, supermarkets, all of whom are required to observe the new, as a matter of law, now required to, the distancing rule of 6 feet between all customers and staff. And a short list of Home Depots who are going to be specifically named in the regulation. I don't want to run through that list because I'm bound to get it wrong off the top of my head. But everybody else, all of the businesses, all of the people are required to limit public congregations to no more than 10 persons. The curfew, there's going to be a list of agencies and areas, like for instance, sanitation workers, medical personnel, CUC staff, those sorts of people. but they'll be on a list. And each worker is required to have the company ID as well as a letter from the CEO, managing director, manager, whatever, saying this person is required to work outside the hours of inside the hours of the curfew.
Okay.
So that's how we're managing that. So if you're a CUC worker, you have your CUC, and then the managing director gives you a letter saying, I need Donna to work during this period. So that when an officer stops the individual, they say, here you go.
Okay.
We're not going to because that's just too complicated. For NEOC, for instance, to issue IDs for everybody. Use your corporate ID.
Yes.
Those that don't have corporate IDs, because like myself or the governor or whatever, then NEOC will issue us with one.
Okay.
Right?
Okay. Thank you for the
I
clarification.
think you also mentioned about boutiques.
Yeah.
I don't think that the premier was trying to shut down any.
No, we're trying to shut down anybody.
Okay.
What we're saying is we're appealing at this stage.
Yes, sir.
You know, tomorrow our view, the position might change if we get some really alarming information about community transmission, for instance, and the advice from the medical professionals is, listen, we really need to lock Cayman down. The rules will change. I mean,
Yes.
that's how this is operating. But all we're saying now is we're asking businesses slow anyhow. Send home as many people as you can. That still allows you to keep your business working. Hopefully, many of them can work from home. But I know a carpenter can't work from home on the construction site. So I mean, sometimes it's just not possible.
Right. Okay. I have one other question before I go back to the media from the public. What advice would you give to those who have private home pools? And you may have athletes that may want to continue to train in small groups in those home pools. We know strata pools have been
Terrible idea.
locked off.
And hold that.
The reason that we're asking people not to use strata pools is not for the water itself. It's for everything that's around the strata and for all the pools. That's why we've asked that no pools where lots of different groups will use them are to be used for the time being. If that pool is solely used by that one household and nobody else, there is no problem. But it's only, so that would be a private home pool where only the private household uses it. But we have said no to strata pools and no to public pools.
Okay. Also, outdoor training for athletes who may want to continue training for whatever. Can they train in groups of one or two? Can they outdoor at the Truman Bodden Sports Complex, for instance, rather than in large groups?
Well, the regulations say that no sports groups can meet, so the answer would be no, they cannot.
Thank
They would
you.
have to do it individually.
Thank you.
Seaford Russell Jr. came on campus. Sticking on sports, the International Olympic Committee has refused to postpone or cancel the Olympic Games in Tokyo. Yesterday, we saw that Canada and Australia both pulled from the Olympic Games. To the best of your knowledge, Mr. Premier, where are we in following in those footsteps in terms of the Cayman Islands pulling out from the Olympic Games?
Well, I'm not the sports minister, but I know what her view is. I think we have quietly come to the view quite some time ago that we're not sending anyone anywhere anytime soon.
For you, Mr. Premier, I've been speaking with local farmers recently, and a lot of them are encouraging many residents to get into self-farming and crops and et cetera, et cetera. You, being a farmer yourself, what would be your advice to the public in these uncertain times?
Advice regarding,
Local farming, farming for themselves.
you mean whether now is the time to start that? I don't know if I would be trying to start anything right now. Logistically, it's just very, very difficult. But I mean, generally speaking, I certainly encourage, as many people as possibly can to put something in the ground and watch it grow. I mean, that's so special to me. just how it makes me feel, but that's just me. But now is not really the time I would try to encourage anyone to do anything that requires logistically staff, supplies, material, all of those things. Now is the time to hunker down, especially these 2 weeks ahead, and let's see if we can ride through the worst part of the storm. We get to that. If we've managed to contain the virus, we then start taking other decisions so that we can continue to live a decent existence here, while hopefully the virus burns itself out around the world.
Just want to add to that today's Compass has the Minister of Sports view on sending athletes to the Olympics. And also, I know that her view is also grow what you eat.
Eat what you grow.
I have a question as it relates to public transport. Premier McLaughlin, I know that you mentioned that, that you may have mentioned that there may be some ways to work around that, but as you can appreciate, a lot of people depend on public transport. So there are people are asking, what are they supposed to do at this point? What do they do?
Yeah, well, stay home as much as you can, it is my view. And employers who absolutely regard the employee as critical to the business, hopefully they will help to work out some arrangements in that regard. We are still thinking this through, but we believe, particularly, I'll tell you my view, which I came to yesterday, or was it Saturday night? I don't remember. The days just meld one into another now. Is what's happening in the UK, and how the strong messaging that they are now delivering against public transportation, because people are up against each other all the time. This issue was raised in some of the press briefings earlier, and we talked about possibility and we were working on regulations to limit the number of people that could be on one of these buses at any given time, and one person to seat, and all sorts of things we were working on. But when you see the pace at which this thing is progressing in the UK, it makes you think again, and it certainly made me think again. And I said, and the reason we didn't want to do it is, as I identified in previous press briefings, we know it is hugely disruptive and inconvenient to people who need to get about. But we believe at this stage that the health risks outweigh the inconvenience.
Okay. Premier McLaughlin, one more question before we move back to the members of the press. Someone is asking why it appears to be that we're doing this in a phase-by-phase stage, as opposed to just locking down for the 14 days and then starting back life again with some normalcy.
Well, we couldn't really do this effectively before today. We needed to get as many people out of the country as we possibly can. We needed to secure the borders so that we know what we're dealing with here. And that's why we're going about it in this methodical manner, as well as I've said many times, trying to make sure that our response is proportionate and rational and proportionate to what we perceive the risks to be at any given time. We still, at least as I'm sitting here, have no evidence of community transmission, although I think all of us believe that it must be happening. So I might come back here tomorrow and tell you we're going to shut the whole country down right now because of what we know. It's constantly evolving, and we're constantly trying to stay ahead of what we believe that the perceived risk is. It is very, very difficult to lock down an entire country, especially a little place like Cayman, for extended periods of time. People have to live. We import just about everything that we have. So we're weighing all of these considerations constantly and trying our collective best to make the best decisions.
Okay, thank you. Reshma? Felicia?
Felicia Rankin-Stallings, Radio Cayman. So with the curfew coming into effect soon, what do people do in certain emergency situations, like if a parent has a very sick child, but it's already past 9 p.m. and they don't necessarily want to call the ambulance, they feel like they could take them themselves? What are they meant to do?
I think we should probably let the police commissioner handle that one.
Thank you for your question. I think it's a practical application of the curfew and of the law itself. That's an emergency, and we'll deal with it as a medical emergency.
So a parent wouldn't have to be frightened that they'd be seen on the road at night.
I don't think anyone needs to be frightened at all. You need to stay indoors, as has been discussed here at the conference, and for the right reasons. And we're hoping that people will assist us and work with us fully.
Ralph Lewis, Caymanian Times. I have 3 brief questions. First one is for the Premier. Is it the first time that the Cayman Islands has seen a curfew?
No, sir, not at all. You don't remember Hurricane Ivan? 8 weeks of it?
Yeah.
Oh, just to remind some of us. Okay. And have the NAU department seen a huge increase in assistance, in requests for assistance from local community members?
Not huge, not yet. But you're talking about NAU? Did you say NAU?
NAU, yes.
Or you say any unit?
No, NAU.
NAU. No, not yet.
Financial assistance.
Not yet, but it will come. I mean, without question, it will come.
Okay. And has the staff been ramped up to deal with the processing and of these requests?
We're still working on making sure that is right. I need to get a briefing after this. There was a meeting on Friday evening between my chief officer, my councillor, and other staff, talking about the logistics of how we do this to respond to this issue. So, yeah, a lot of work is going on in the background.
Okay. And my final question is for the minister. Are there plans to test the elected officials and the governor?
I wish we did so a long time ago. But the right answer is that, as Dr. Lee's been saying for some time now, if you're not showing certain symptoms, as if you would call the hotline, they'd give you advice as to what to do next. If you're not showing any symptoms, I think it would be very selfish of us to take up those mostly needed tests. It is a limited amount of test kits that we have, and we have to ensure that the people that need them more urgent gets the opportunity to be tested. I don't know if Dr. Lee wants to add to that.
That's correct.
Reshma?
Okay, thank you. Dr. Lee, this is for you. Just to go back to the 2 cases and to build on what you said about the Honduras patient who would have passed away. In terms of the 2 patients, are there any further steps that you're taking in relation to their contact or their interactions with the community? And similarly with this Honduras patient that would have passed away, should members of the community who know him or may have interacted with him reach out to the HSA, or what sort of guidelines can you provide for them in relation to these 2 incidents?
First, before Dr. Lee answers, let us establish that the person that we're talking about was a resident in Cayman and was married to a Caymanian and probably been living here for many years. So it's not just a Honduran national.
Thank you.
So firstly about Health City, clearly they're in a different and unique position. So Public Health England came and advised of what we should do, and we've followed their advice, and Health City continues to apply that advice to the care of the staff and the patients. I didn't say whether it was a staff or a patient because I don't know the details as yet. I think you mentioned the word patients, but I don't know the details, Reshma. And they continue to do so now, to follow the Public Health England advice. As far as any contact of somebody who we have concerns about, Public Health will contact trace and do the necessary for each case, and that has been done in this instance, yes.
Okay, just to correct, I didn't mean that they were patients. I meant in reference as COVID-19 patients.
But I think just to say about that, for Health City, I know that many of the people, some of the people that have been positive have had very mild symptoms, so they didn't actually become patients.
Okay. Over the weekend, we heard about, and it was reported to us from GIS, that a student who is in isolation was taken to hospital for assessment without, breaking any rules of personal information. Can you provide us with an update on what's happening with that student?
No, for all the reasons you said about the privacy for any individual, this person's already under a lot of scrutiny. I don't have anything further to add in this matter.
Okay, fair enough. Returning to the reagents, you talked about it on Friday that we were expecting some. Can you give us an update on how many have arrived? Have they arrived?
I mean, reagents continue to be in short supply, and that's an issue which we are doing our best to address. Just for your interest, Public Health England have engaged with something called Crown Agencies, which is the major procurer on behalf of the United Kingdom government. They've been trying all over the world to try and source some of the things they've been wanting to get, and they're finding incredible difficulties in doing so, and have got very limited supply. So it's something that is an international issue. The reagents I referred to last week have arrived. They've given us a capacity of about an extra 100 tests. So we have in round figures about 200 tests that are still available. But it is round figures because sometimes we have to run tests twice for laboratory scientific reasons. We have a number of orders that are out, and we have confirmation that some of them should be coming, but it is always the issue of when they do actually arrive.
I know you said that we had sent some tests back to. We haven't. I have to ask.
Absolutely. I mean, I'm as desperate to know about them as you are. It sounds like they got, from what I understand, they got to Trinidad on Friday, but the courier doesn't deliver on the weekend, and so CARPHA were trying to get them out of the courier on the weekend, but they failed to do so. So I have not had any news today, but I'm hoping that they've now hit the right destination.
If I may continue, please. Just building on what Mr. Lewis talked about, Premier and NAU. Over the weekend, the ministry issued a statement adding that they're exploring assisting expatriate workers, foreign workers, as this situation progresses. There have been some who have been critical within the community of extending this facility to foreign workers. How would you address this, or can you address this and respond to these criticisms of government extending this assistance outside of Caymanians only?
Well, let me say this. I believe whether you're Caymanian or not, you need to have a roof over your head and you need to have some food to eat. This is a humanitarian issue. We are not opening the doors of NAU, the coffers of the government, to persons who are here temporarily and not Caymanian and saying, here, come and take what you want. NAU will assess each situation and determine whether or not it is necessary for government to ensure that the basic human needs are met during this time of crisis when the country borders are locked down and people, even if they wish to leave, cannot leave. That's all I was trying to say. I'll give you some real life examples. This morning, as soon as I came in, my PA said to me, there were 2 Cuban refugees who are here lawfully, who were working at a particular establishment. They laid them off on the weekend, gave them 1 day's pay. They are desperate. What should we do about that? Tell them, go fish? We have to ensure that anyone who is living here has the basics to provide for a decent existence while they're here. These are circumstances that in the last 100 years, the world has not faced. And Cayman we pride ourselves as a Christian country, living by Christian principles. I don't know who learn certain Bible verses in school, in Sunday school, but I know I did, right? So do unto others as you would have them do unto you. And for as much as you do this to these, the least of my children, you do it also unto me. I live by those principles.
Thank you, Premier.
Mr. Premier, just to touch back on the curfew implications that you guys have put out, we know that the grocery stores, supermarkets are generally open until 11 o'clock in the night. With that time now being compressed, are there any plans to have security implemented in the gatherings now with the times being lowered? I would assume that more people will now try to get in before a certain time. Are you guys doing anything to avoid congestion?
Well, we've been talking to the supermarket operators. I personally spoke to one of them over the weekend myself, and they themselves have been working really hard. They understand the risks and the challenges that are created by the sheer number of people who are descending upon the place at the time. Over this weekend, things quieted down significantly. The operator I spoke to, who said he had spoken to the other two supermarkets as well, said that this Saturday was the slowest day that they've had in a long, long time. I think maybe everybody's freezers and cupboards are full, or people are running out of money, or whatever. But I think it's slowed down significantly. I think people are getting more used to the idea that this is going to be a marathon and not a sprint. That food and other supplies are going to be generally available, notwithstanding all of the challenges, and I hope are calming down more. But the police have also stepped up their surveillance. I know police were in at least one of the supermarkets over the weekend, and the commissioner is here, he can speak for himself, but I'm sure that more of that will be done, because we are going to get much more serious about this issue now. And I hope people don't believe that they just made these rules and we don't really have to worry about them, because people are going to get arrested if they don't cooperate with what we're trying to do. This is a national health threat. It's not just about some small infraction. If you don't follow the rules relating to social distancing and behaving, you are endangering the entire community.
I have a question from CNS asking about testing again. Are testing rates likely to increase anytime soon as we remain in the dark about potential community infection? And will the criteria be relaxed, given the fact that people who recently left Cayman are testing positive in other jurisdictions, and that no one here needed to have traveled any further than Hogstye Bay before the port was closed to have been exposed? Is this a public health? Are we worrying about this?
The testing guidelines are set out by the World Health Organization. They're not set out by the Public Health Department here, and those are the ones that we are following. They have subtly changed over the weeks, but they are largely the same. Well, they're not. I don't think many people would notice a difference from when they started out, and that is what we're following.
Okay.
If I could preface that, if we had the ability to do much more widespread testing, and that may be coming online. So I'm sure people have read about the kits that are coming, and I've heard rumors that they may be approved in a number of different jurisdictions. So it could have happened while we're talking. I'm not sure. But if we get some that have been approved by a substantial national public health agency, it will probably change the way we manage this situation. But until such time, we are using the current WHO guidelines.
Okay. One other question, Premier McLaughlin, maybe you can take this one. Is there any consideration being given to assist, a lot of kids are home now, a lot of people are working from their homes. Of course, that means increased electricity bills for everybody across the board. Any consideration being given to assisting, I guess, everybody that's doing that, basically, the entire country? Any financial assistance for people who will incur increased electricity bills because of that?
Well, we're doing everything we can, but government's resources are not unlimited. And quite frankly, if we made a concession for every request I've had, I think we'd be broke by the end of next month. We are working as hard as we can to reduce people's obligation to pay now when you're not earning. In many cases, so again today, seen another bank, CIBC, has said they are offering up to 6 months holidays on loan and mortgage payments. I think we're going to see more of that. We've had concessions, similar concessions with respect to the water company, the water authority, CUC. So people's outgoings should significantly reduce. Rubis has reduced the cost of fuel to the retailers by 40 cents a gallon. That's a huge cut. The fuel prices generally have fallen, collapsed, some will say, over the world over, and therefore CUC bills are bound to fall significantly because the fuel factor is a direct flow through. So all sorts of measures, and we are exploring as many as we possibly can, are being put in place with the cooperation for which the government and the entire country should be most grateful of the corporate community to help all of us get through these very, very difficult times. And we will continue to explore what we can do. But I can't give an undertaking to pay or make a contribution to everybody's electricity bill. Otherwise, Ms. Donna, you mightn't get paid month after next.
We can't have that happen, can we? Okay, we're going to wrap up here in about 5 minutes. So any final questions?
Thank you, Donna. Just building on what you've said, earlier today, the opposition leader issued a statement, and he has written to you recommending a pension holiday for workers to kind of offset these kinds of situations with high bills and so forth, as well as recommending allowing residents to draw down on their pension, I think $850 a month, to kind of help sustain their living as we continue to deal with the coronavirus crisis. Is this something your government is considering? Are you open to that idea? I know you talked about dealing with pensions before, but can you update us on that?
Well, someone's told me that that the opposition has issued a statement. I've just recently seen a letter on my desk. I'm not sure whether this is the opposition, being willing to sit down with the government and work through these things, which I've talked about, or whether this is not, just political grandstanding at its worst during a major national emergency. If the opposition truly wants to help us, they'll come and sit down around the table as I proposed and talk about these issues and come up with a collective position rather than sending out some public statement saying this is what the government should be doing. If the leader of the opposition and his team were being really earnest about this, he would have written me. He would have said, "Can I come in and talk to you about these things?" And we'd work together. What we saw was a public statement followed swiftly by a letter to me saying, "This is what I think you should be doing." So I hope we can get past that. Lord knows there's plenty of time for politics, but now is not that time.
I know you had indicated that you intended to meet with the opposition and set up a meeting. Is that still the plan? And has that been arranged?
Well, it is now over to them. I'm going to tell the leader of the opposition, listen, if you really want to dialogue and to talk about these things, as I mentioned on Friday, then let's do that. But if you're going to conduct this matter in a public statement sort of format, that is completely unhelpful to what we're trying to do. We are at the start of a crisis. I hope it doesn't get any worse, but all of my instincts tell me there's going to get a lot harder over the next little while. now is not the time for political grandstanding and public statements about what you would do if you were the premier, because that's essentially what they're saying, and what you would do if you were the government. We need to have honest, earnest dialogue about what's best for Cayman, so that we all come out the other end as intact, as whole as we possibly can, and then you can start the election campaign about who's going to be the next government, who's going to be the next premier. It certainly can't be me.
On a lighter note, over the weekend, we saw a picture from one of the students who were in isolation, Giovanni Ebanks, and his sentence. Alden said so. What message would you have to send to the students who are engaging in isolation practices, and any words of encouragement for them in light of what we saw over the weekend?
Yes, I was delighted to see that, although a little embarrassed. But yes, it's precisely the kind of thing that I think young people need. It encouraged me, let alone them. And it's very hard for anybody to sit in isolation, because isolation means you're alone for 14 days with just a television screen and your phone. And so we know they're going through a very, very difficult time. We're doing everything, as he said, we possibly can to make it easier. But how you shorten the days, is impossible for us to work out. So I commend them, all of them, for this act on their behalf, on their part, because they have behaved incredibly responsibly, as we would expect of the next generation of leaders of Cayman. They are, as I've said, the cream of Cayman. These are our young people who are away at university, getting ready, preparing themselves to take their place in this community, and it's marvelous to see them acting so responsibly. I am incredibly proud of them.
And with that, we're going to end the press briefing today. Again, if your question hasn't been answered from the public or from the media, you can go online to gov.ky tomorrow morning, where those questions, and go in the FAQ section where those questions will be answered for you. Also, if you're a civil servant and you have any questions related to yourself being a civil servant, you can send emails to CIGHRconnect@gov.ky. And thank you, of course, to our listening and viewing public for joining us here on this press conference today. We'll see you back here again tomorrow.